Hi, my name is Caitlin McCarley. I'm a student PTA, and today my presentation is on chronic obstructive pulmonary disease, established disease. So, chronic obstructive pulmonary disease, which is abbreviated COPD, is an often preventable, non-contagious disease that does affect a person's lungs by making obstructions, which reduce the amount of oxygen intake they can have and makes breathing more difficult. According to Healthline.com, 12 million adults are diagnosed with COPD, and many are undiagnosed due to the mild symptoms that occur at the very beginning of this disease. COPD is also the third leading cause of death in the United States. The etiology of COPD. So there's four main causes for someone to be diagnosed with COPD. The main one is from smoking. You could also have it from having poor air quality or exposure to dust, fumes, smoke at work, or genetically. So if the patient themselves smoke or if they're exposed to secondhand smoke, this increases the likelihood of you getting COPD because it's a vasoconstrictant, and so that's going to let less oxygen in since you're going to have difficulty breathing. If you're repeatedly exposed to air pollutants, that's going to irritate the lining of your lung and cause inflammation, like flare-up of those symptoms. And then the less common way is genetically. So if you could have this disorder because you have low levels of a protein found in your blood called alpha-1 antitrypsin that's made in your liver, and its job is to protect the lungs from the inflammation, from the reaction, or from inhaling the irritants. Treatment, surgery, or medication options for patients with COPD. So according to the CDC, medications can alleviate some of the symptoms, such as coughing or wheezing. According to the Healthline.com, bronchodilators are going to help relax the lung muscles and let more oxygen in, so that'll increase your intake. And these are usually taken through an inhaler or a nebulizer. Glucocorticosteroids are to reduce the inflammation in the lungs and to lower mucus production. Healthline.com states that surgery is an option, but it's usually one of the last resorts. Either the treatment hasn't worked before or it's a severe case of COPD. So some surgeries they could have is a bullectomy, where they remove air spaces from the lungs, a lung volume reduction surgery where you remove the dead tissue or damaged tissue in the lungs to let more oxygen in, or you could have a lung transplant where you get an entirely new lung. You also will be given antibiotics because you are more susceptible to an infection. The Mayo Clinic did introduce a new surgery that they have been successful on in 2019, their very first one, that they take the lung volume reduction surgery and they use a tiny valve in that. So it's a one-way valve that's put in the lung, and what it does is allow oxygen to leave the lungs in exhalation and not return. Because normally for COPD patients, they have remaining air in their lungs still after exhalation, so this will allow the oxygen not to return back into the lungs. So it'll allow the diaphragm to be more efficient and fill up more. Here are some common signs and symptoms of patients with COPD. So according to the National Heart, Lung, Blood Institute, most people that have COPD, their symptoms do not appear until significant damage is done, because most of the cases in the very beginning are very mild and are mistaken for a common cold or another disease. So the amount of severity of the symptoms do depend on the amount of damage that has happened to the lungs. But once these symptoms have occurred or have appeared, they are going to experience increased mucus output. So normally your lungs already make mucus, but with the irritation that your lungs are having with COPD, it's going to increase the mucus output. You will have shortness of breath, because you're not getting as much oxygen in as you normally would. You could be more susceptible to mental illnesses such as depression and anxiety, because you might not be able to be as active as you once were and as social as you once were, because this does limit the amount of activity that you can do. You will have increased coughing, and that's to try to cough up and break up the mucus that your lungs are producing more of. You will have difficulty breathing, chest tightening, wheezing, which is a very um, it's a very high-pitched sound that is normally heard in exhalation. You will have lack of energy and shallow breathing. You're not going to be able to take as many deep breaths as you once were. In later stages, this disease progresses to make the patient feel more fatigued. They could have swelling in their lower extremities, unexplained weight loss. It can progress to the patient not being able to perform basic ADLs by themselves, and they will have low endurance. So here are some of the symptoms that if you feel you need to see medical um, personnel right away. So cyanosis of the skin and lips, which is turning a blue color, trouble or painful breathing, rapid heartbeat, which is called tachycardia, or confusion and attention deficit. If you cannot focus, if you're disoriented, these are some signs that something serious could be happening. COPD is a progressive disease, so the symptoms do get worse as time goes on, as the damage continues, and it does have exacerbations where the symptoms are worse at times. Medical and surgery management required. So there's currently no cure for COPD, but there are a lot of treatment options that help alleviate a lot of the symptoms and allow the patient to remain active and try to slow down the effects of this disease. So patients with COPD are strongly encouraged to get the flu and pneumonia vaccines because they are more susceptible to those infections. For patients that have the alpha-1 antitrypsin deficiency, they will be given that protein, or they could just receive the normal COPD treatment to try to decrease that damage to the lungs that they're having. And then, according to the CDC, COPD can be diagnosed by a simple spirometry test that measures lung function. You can listen to heart auscultations to hear any abnormalities or hear the wheezing that might be happening. You can have a CT scan, a chest x-ray, or a blood test. Some health problems that a patient with COPD could have along with their normal symptoms. So they could have high blood pressure, heart disease. They haven't found that correlation between heart disease from COPD, but they know there's a relationship there. Lung cancer, of course, and they are more susceptible to getting lung infections or catching the common cold, flu, or pneumonia. And if the patient's already diagnosed with emphysema, chronic bronchitis, or asthma, they're more susceptible to getting COPD. The precautions and contraindications. So you would not use the phototherapy modality because of the convection of the collagen can irritate the lining of the lungs and cause that inflammation. The patient should avoid very high altitudes because there's less oxygen up there and they already have a difficulty time breathing. And according to the CDC, precautions should be taken during strenuous aerobic exercises and they should be limited due to the decreased breathing ability that they have, and when they exercise, they need to be closely monitoring their oxygen levels. Early intervention. So if the patient is a smoker themselves, they're going to be educated very early on about the negative effects this does to them, and they're going to be encouraged to decrease that smoking or to stop altogether to prevent any further damage. If they are exposed to the air pollutants at work, they are going to be advised to wear a respiratory mask or other equipment that could help with their breathing, or talk to someone at work that could accommodate for this disease. Some physical therapy treatments that a COPD patient can receive. They're normally going to receive respiratory therapy also, so pulmonary rehab, where they'll be educated how to breathe more efficiently, how to lower their exertion rates during activities, and nutrition and exercise tips also. You could also have an exercise program in an inpatient, outpatient, or maybe in a community center to give the patient the social aspect of working with other people that have this disease too and exercising together, to give them a social aspect to try to decrease the likelihood of getting a mental illness like depression or anxiety. and you also as a therapist need to address this with the patient. According to the CDC, patients usually are required to use special equipment such as oxygen tanks and nasal cannulas to give them extra oxygen intake. Along with oxygen machines, a patient with COPD could also benefit from using an air purifier, which is going to clean the air from like dust particles, pet allergens, secondhand smoke, and so it'll clean the air for you to be able to breathe in more and not cause that inflammation of the lungs. Or you could have a CPAP machine during sleeping usually that's a continuous positive airway pressure that increases the amount of oxygen that you can intake. Healthline.com states that an exercise program is mainly created to maintain strength, mostly postural strength, so core strength, to keep postures straight and to help increase that breathing ability. So it'll be small, low-intensity exercises and some cardio to keep the lungs and heart working strong, but nothing to increase shortness of breath even more. According to the National Heart, Lung, and Blood Institute, patients of COPD should wear loose clothing and try to arrange things in their house to be more accessible and to decrease your exertion levels on your task. So a therapist could do a home exam of an OASIS functional test to see how much assistance they need, how functional they are, and how you can arrange things to be more accessible and more efficient for the patient. I hope this presentation has given you a better insight into the disease, how it's caused, how it affects someone, and how you can still maintain a normal life with this disease. Here are my references, and this is the conclusion to my presentation. Thank you.